Welcome back to Studio 10.
If you take prescription medication, you know how expensive it can be to make a trip to the pharmacy, but luckily there are a few things you can do to cut costs. Our Candace Murphy has been doing some research, and she has today's Consumer Watch. Candace.
That's right, Joe. With cold and flu season right around the corner, it could cost you a pretty penny to get better, especially if you're prescribed medication. So if you have to visit the pharmacist because you're sick or if it's just part of your everyday routine, there are some quick tips you can use to help you save. If your prescription medication's breaking the bank, there are some simple ways to save and cut back on costs.
0 and 0 on that copay line.
I met up with Ben Christopher of Christopher Pharmacy, who says the #1 way to save if you have insurance is to check the formulary with your insurance company. Now, a formulary is a list of medications that are covered by your health plan.
It's usually about 3 or 4 pieces of paper, really small print, so you take that to your doctor's office. If they're going to prescribe you something, check that against the formulary.
Another option is to ask for a generic prescription drug in place of the brand name drug.
Generics are going to save you on average about 80% compared to the brand name drug.
If that's not an option, don't worry. You can still save on brand name medication by using coupons. There are websites like needymeds.org and internetdrugcoupons.com. At Christopher Pharmacy, they've already done some of the work for you.
These orange stickers, which we have, and these medications are only available as brand names. So those are the ones that we have coupons. Coupons are available for us.
Prices can fluctuate and change from week to week, so Christopher advises shopping around.
If it's at another drugstore down the road, you could be saving significantly, upwards of 20–30% off your medications.
Lastly, ask your doctor for samples of medications before buying a full month's supply, so you know what works and what doesn't. Even though it's a good idea to shop around for the drug, Christopher advises going to the same pharmacist so that they know how you're reacting to it and how your drug is working with you, and then they can advise you to switch to another one or just kind of work with you for what works best with your body.
Yeah, one of the things you mentioned, which I didn't know the name for it, but the formulary, that list, that's very important too, because all the different medications have different levels of how much they cost depending upon your insurance provider, so it's really good to take a look at that. So that was a great point.
Definitely. That will definitely save you some money, and you can go in prepared.
Yeah.
And that way you kind of know what you're looking for going into the doctor's visit.
Great tips on ways to cut costs and be smart when it comes to prescription medications. Thanks a lot, Candace. Coming up, we're back in the kitchen with Chef Ben.